It's always a balance between tear production and tear drainage. So things that increase tear production is irritation. So irritation can come from dry eyes, like we
Mm,
mentioned, or something under the eyelid. You could have inflammation. Someone who
mm,
suffers from allergy can have like regular kind of lumps that look like cobblestones on the lid and cause, the tap to turn on too fast.
mm.
Could be a foreign body or something underneath the eyelid or a little lesion. Sometimes it's just making the eye water. And then other times it's transportation of the tears, which are, flowing down generally the lower lid from lateral to medial. If that downhill vector is interfered with, so lid laxity, the lid falls down a bit or turns out a bit, then or the drain hole itself only slightly turns out, that's enough to make you water. Often the lid laxity can be contributed by a nerve palsy, someone who has a Bell's palsy or facial nerve palsy. That can be one of the vectors or pathway problems of getting the tears in the right place. And then it can also be what everyone thinks about, as everyone says, I've got a blocked tear duct, doctor. So, you could have the drain hole of the sink is medially on the lower lid. If that just gets a fine membrane over it or is scarred or closed, or is slightly, as I say to patients, on the side of the sink rather than the bottom of the sink, so it's turned out, or the drain pathway is blocked. And so we call that nasolacrimal duct obstruction. And we evaluate all of these when you come in and, look up the eyes under the lids, and the lid position, and then also squirt water down, which is a bit uncomfortable, called a lacrimal syringing in the chair in the office, to work out which part of that, and sometimes multiple parts of that, are playing a role towards watery eyes.
So in a sense, you're like a plumber for the patient's eyes, is that right? And their
Totally.
tear
I
system.
do say that to them when I'm grabbing my stuff ready. Yes.
Well, so when should someone come in for an assessment rather than just relying on over-the-counter drops?
Look, so I would probably say, the first instance, if you have a watery eye, is try the lubricating drops. See if that reduces the reflex triggering of tears and the overproduction of tears and keeps the eye comfortable, and then your tearing is resolved. And if that's the case, well, you've kind of done your own detective work and it's dry eyes, which is very common in postmenopausal women and things like that as we get older. And so I think if the symptoms are warranting you to seek intervention. So if you're still watering despite lubricating drops, or you're on a mucus production, or you don't like the look of it, despite a trial of lubricating drops, then I would come in for an evaluation, or you can come in up front if people don't like to trial those things themselves. But often it's worth picking up a, chemist over the counter dry eye lubricant, and possibly one without preservatives in case that affects you and causes more irritation.